If you ever wondered how many push-ups you can do 6 months after having your chest open and having part of your heart cut out, that's your answer. Welcome on this summary of 6 months of recovery after septal myectomy. What is it for you in this video? If you are getting ready for the surgery, if you are considering having that surgery, or you know it's inevitable, you will know how you will feel in 6 months after that. You will know what struggles you can encounter. Obviously my struggles may be different than yours. Side effects are pretty random. It's like the perk reroll, you don't know what you get. I had my own thing that I had to manage, and until now I actually tackled almost all of them, almost completely. So I'm getting there. It was worth it. I went for holidays to Odessa recently, and I was walking a lot. And something amazing that I noticed is that my whole life I had sensation of some sort of block mixed with some feeling of sadness in the chest. I am not sure how to explain that differently. This is the best I can. That's what I was feeling every time I was doing cardio, even on the moderate level. Now it's gone. Yes, I am tired in a different way now, but I believe this is just a fatigue after the surgery, after all of those struggles, and it's getting better. So I'm confident that in some time, in a few months, maybe a year, it will be gone as well. It makes me think that this whole struggle since December last year, when the cardiac episode happened, this whole stress, the surgery, if I am about to live the next 30, 40, 50 years, I feel like it was worth to go through all of that struggle to get this result, if that makes sense. Another positive is that it rewired my brain in an amazing way. I was never that happy, for sure. The density of happiness throughout the day is very satisfying. After going through all of that struggle, through all of that stress, through all of those hardships, those things that were bothering me a long time ago, they're not bothering me right now at all. My threshold of stress was pushed so far that it is so hard to piss me off. Like, honestly, life is short. It is really not worth to stress at all. Everything is just so great. Why to destroy that with some simple issues? Majority of your problems you can solve with money. So if you can solve majority of your problems with money, then is it really a problem? It's just expenditure. It's not a problem. It's just something that you have to spend money on. Whatever I cannot fix with money or skill, then I just have to let go and move on. When my heart was in the worst condition, just before the surgery and just after the surgery, even the slightest stress was causing me to have lots of symptoms, lots of things going on. My heart was speeding up, I was feeling dizzy, so I had to learn how to let go things quickly. Like someone did something not nice to me, and the longer I was keeping that anger inside, I was just feeling so clearly that it was making me sick. So I just had to let go immediately, and it was a good training for a few months. I know that people after certain big health trauma, they don't recover psychologically, they don't recover internally. They become grumpy, they become heavy, they are not smiling, and it's because two things. First, they didn't digest the lessons their life gave them. It was extremely painful to go through all of that, and I am thankful to have very good friends that are very good listeners, and I could speak about those problems. I could show up and share those problems with them, and they created a space for me. I could even repeat some things a few times until I got the sense out of it without being shamed, without being told that it was a long time ago, just get over it. No one was like that in my company, so I'm just blessed. And yeah, you just have to experience all of that. Without that, it will crush you. And there was a period where I became grumpy, where I became heavy, and it was the point where I could stay like that to the rest of my life, being just kind of angry that this happened to me, and even not very consciously, right? My face would be like this, and my tone would be very heavy and pleasant, and I would be saying that, oh, I'm fine, it's all good, no worries, I'm fine. Everything shows as I'm not fine at all. The second thing is that I am very happy that I'm a physiotherapist. I was able to solve all of my issues from the scar tissue perspective, from the tightness around the chest perspective. I was able to resolve the neck issues, and where I could not reach, I asked my friends to work there, and I have few friends physiotherapists. All of them, they work in a different way, chiropractors as well. I had amazing adjustments. I had craniosacral therapy a few times. I had fascial manipulation a few times, and all of that really helped me. It's just impossible to be happy when the body is tightened up. It's just impossible. It affects how the thinking look like, how you feel. I just checked how the recording, how the view is looking like, and I was just checking the voice of the video, and I noticed that there is the invalid sign just behind me, and that's kind of a synchronity that is feeling like a little joke from the universe. That was actually one of the main themes of the whole recovery. I didn't want to become a person of determination. So I didn't want to resign from any quality of my life in any sense. The whole objective of going through this whole journey was to have my life back, have my trainings back, have my job back, have my quality time in the nature back. No compromises. And every decision I took to go exactly there. I made all of the decisions in a way that would allow me to get to the point where I could consider myself healthy. That's why I decided to have an open heart surgery, because the risk of ICD implanted was lower, much lower, and the scar is not decreasing the quality of my life, but ICD would. So right now, 6 months after the surgery, the risk of having ICD, that I would have to have that, it's actually 0. So I did that. The only thing that I have to still deal with is a very little dose of beta blocker, like 1 milligram of Concor, which is a silly dose, but I still need it. When I don't take that, I feel dizzy, I feel heavy on my chest. It makes me feel like I am not ready to resign from that medication right now. Yet I believe it's going to happen. There are some ways how I can still improve my health, and it's still getting better from all of the perspectives. It will still be improving up to 2 years after the surgery. So there is a chance that I will be able to resign from the medication as well. And then I would be like, nothing ever happened. I would just have a scar. I still have to have the wires taken out. It's going to happen next year. Okay, sweet things are nice to talk about, but there were also some problems. I didn't expect it's going to be so heavy, honestly, in moments. And there were side effects that I had to deal with. The worst side effect that I still struggle with to some extent is fatigue. And it's not the exact fatigue that you would expect from the heart perspective. It's the fatigue that is kind of deep within the body. It feels like at some points I don't have the energy, like I have no power at all. It is getting worse if I apply any kind of pressure on my body. So if I work on the patients, if I do gentle training in the gym, it's fine. But the moment I decide to put pressure, to push more, either physically or mentally. So for example, I was doing my website, and at some point I have a brain fog, I don't want to do it anymore. So you know these moments, these are normal moments in your life. You have to push through. So pushing through still gets me some kind of a hangover of energy, and that lasts sometimes a few hours, sometimes even up to 2 days. Okay, it's not that bad anymore. So I believe it's going to pass somewhere in the future. Right now, honestly, it's 15% of the problem that I used to have. When I will be able to get out of that completely, when I will be able to train and get stronger consecutively, I'll definitely do a video about that, because I know lots of people are struggling with that. At some point, YouTube kind of heard me, and the algorithm started to show me the videos of people struggling with this chronic fatigue syndrome, ME, CFS, I believe that was the name. And if I would go to the doctor with the symptoms that I had at that time, I would definitely get that diagnosis, but I didn't. It's because I don't believe the conventional medicine is able to fix that right now. So there was no really a point for me to look for help with that. Time healed that, and lots of other things around that I did. The next thing was delayed bone healing. 14 weeks after the surgery, I still weeks after the surgery, I had still not healed bone. My sternum was clicking, I was feeling pain while moving over my head, I was not able to put lots of pressure, and I was really worried at that time. I did the CT scan, which showed that I had basically holes in between both parts of my sternum, and that was awful. It really got into my head, and it was 14 weeks later, so it was already delayed and it didn't seem to get better. At that time, I focused all of my attention on solving this issue. I spent lots of money and lots of time and lots of effort to heal that, and as you saw, 7 push-ups. Yes, I felt some bruising, for sure, it was there. It doesn't feel 100% comfortable, but it's stable. I feel wires jumping on top of the tissues. Actually, I feel the tissue jumping on top of the wires, but the bone is nicely stable. So that's solved. Then there was a hair loss. I lost lots of hair. It started 2 months after the surgery, and until 5 months, I was losing crazy amounts of hair. It was just going out of my hand with fists. You know, that was mental. I tried to save myself with supplements, with minerals, with shampoos, and I'm not sure what helped, but it just stopped. Now, 6 months after the surgery, yes, I lose some hair, but this is normal, and I actually see lots of new hair coming out. So it was only temporary, probably because of the massive exhaustion and massive stress. At the end, I would like to say thank you for all of my subscribers. I have right now 50 subscribers on my YouTube channel, which I really appreciate, and these are all of you. You are a random person that found me on YouTube and decided to follow. So thank you very much about that. I hope that you found some value in that and you feel a bit better thanks to those videos. Soon I will be uploading more from strictly physiotherapist perspective. I would like to teach more people about the chronic pain. This is what I treat, this is what I focus on. And yeah, that's going to be adventure. So this year was intense. There was hard, there was YouTube, there were other things as well. We are getting there. Also, I'm going through the speech therapy. I will watch that video and I will check how many times did I do this. That was killing me. And this is my focus on. This is something that I work on. So hopefully I didn't do those that much this time. If you would compare my first videos, probably there is more. We'll compare. You can let me know in the comments how did I do. Thank you for subscription, thank you for watching, and have a good coffee.